Hi there, this is Dr. John Carrozzella, and I am happy to welcome you to this short introduction to what I believe is a very exciting device that we're bringing into the Florida Center for Hormones and Wellness. Just a little bit about myself. I grew up in Connecticut, graduated from Yale with honors in biochemistry, went on to medical school, and after that I practiced orthopedic surgery for 25 years. However, I ultimately realized that the best forms of medicine are those in which you can prevent disease, and I became very quickly interested in metabolic medicine and began to focus on hormones and wellness. I got a master's degree from the University of South Florida in 2016, and I've gotten several certificates in advanced endocrinology and human sexual wellness, and it has led me to the point in my career when I'm excited to be doing what I do in my office, bringing health, wellness, and sexual restoration to so many men and women. It is really a fun profession to work in these days. But I'm going to tell you what, we're going to talk about something really interesting today. And I want you to grab your seat and hold on to your hats, because here we go. Today, we're going to talk about sex. Yes, we're going to jump right in and talk about a subject that really shouldn't be as controversial as it is, but we're going to make it a little bit fun, and hopefully I can give you a little bit of information on what we can do for some sexual rehabilitation and restoration for women as they have experienced some of the ravages of aging, some of the problems with childbirth, and the things that tend to make sex a little bit less enjoyable than what it really should be. So what I'm going to talk to you about is that sex is very important. It's one of the crucial elements of successful and healthy relationships in the human being, and it just is so important. And sometimes I'm shocked and surprised that we don't give it a little bit more attention. And what we'll find is that a healthy sex lives definitely improves mood and makes for stronger, healthier relationships. You know, many married couples today say that sex is a very important component to make a committed relationship strong and endure the troubles and the stresses of everyday life. And, you know, sex is really an interesting thing. The more you do it, the more you like it, the stronger your sex drive is. Interestingly, for women, and you need to pay attention here, the more you have sex, the younger you look. It makes you feel vital. It gives you a healthier pelvic floor. It leads to less problems like urinary incontinence as we age, or urinary leakage. Women with active sex life have younger looking skin. And it has significant medical benefits in terms of the cardiovascular system, because the reality is sex is almost as good as exercise. And in fact, there are several medical studies out there that indicate that is exactly the case. So you can see that sex reduces stress, and it is important in so many ways. Regular sexual activity leads to healthier, longer, and more vital lives. And you know what? We do sex just because it feels good. We like it. It's fun. It brings us closer to our partners, and it's just something that is really, really enjoyable. So what happens in order to make sex successful? Well, we have to have a healthy, strong, good environment. We have to have a healthy environment. So it's important to have a normal and functioning anatomy in order for sex to be optimal. And there's a number of things that we can see that can change a woman's anatomy. One of those, which we're going to spend a little bit of time on here in this little introduction, is vaginal laxity. Vaginal laxity can come about from a number of different reasons, and we're going to get a little bit more into detail on that shortly here. We can also see some deterioration in the vaginal lining. This is usually from hormonal imbalance, and other things such as trauma, infections, or other problems can cause difficulties there as well. Now here's something that'll knock your socks off. Medical studies show that up to 76% of women report some degree of sexual function from one of these reasons listed here. The problem is that even at that number, it may be underreported, because so many women are either embarrassed to talk about sex with their physicians. And you want to know what I've discovered? Many doctors are just afraid to talk about sex with their patients. So it's kind of like a dirty little secret. It goes underreported and underdiscussed. Some of the causes: vaginal dryness, low desire, painful sex. All of these can be addressed in a variety of different ways. But one of the ones that I'm going to talk about today is vaginal laxity. Vaginal laxity is something that comes about often after childbirth. As the baby comes through the birth canal, there's a lot of stretching and trauma, and it can lead to a loss of vaginal tightness. Interestingly, laxity occurs often, even when there is not a delivery that's vaginal. Cesarean section pregnancies can end up with vaginal laxity, and that's because of the weight of the childbearing. The pressure leads to a stretching and a distortion of the pelvic floor muscles and the tissues. So when vaginal laxity occurs, there is a loss of friction, and this leads to a reduction of satisfaction for both the female and her partner. In the worst case scenarios, we see a diminished self-esteem. That self-esteem can end up in a vicious cycle that leads to an avoidance of sex and a decreased sexual intimacy. Sometimes this can be devastating to a relationship. It's really difficult to measure vaginal laxity, but a recent study in Australia showed that 58% of first-time mothers have some form of sexual dysfunction related most commonly to vaginal laxity. So it's a common problem with a lot of women that, interestingly, there is a simple and easy solution. What we see is that vaginal laxity is the #1 reported post-delivery change in women. In over 88% of women after pregnancy, we see this complaint. So let's talk about the treatment of sexual dysfunction really briefly. But I'm going to tell you what, it's not a brief discussion. I've been to a seminar on this over 3 days. It's a very complex subject that has so many different solutions, and you can see a number of them listed here. Surgery is the interesting one. It's associated with high complication rates and difficulties and sensation problems. So you got to ask yourself, isn't there something else? Well, now there is. What I found interesting is that over the years, and if we look in 2016 as an example, photo restoration of the skin was done in as many as 650,000 people. Now that's just photo rejuvenation of the skin. But we also see that in the same year, there were over 650,000 vaginal restorative procedures carried out in the United States. Some of these surgical. So it's a very interesting rejuvenating procedure that's becoming increasingly popular and widely used. Up until now, surgery has been one of the primary focuses, but I'm going to introduce you to the Geneveve system today. The Geneveve system is a device that is actually approved to treat vaginal laxity and a number of other sexual dysfunction issues such as urinary incontinence and others, and it's recognized as a viable procedure in over 48 countries around the world. So it's not just a flash in the pan, it's something that's been out there for a while, and it's starting to catch popularity in the United States. It's non-invasive, it's virtually painless, it's a one-session treatment that can have dramatic results. I've had staff members in the office already undergo this procedure, and we're seeing some really remarkable changes. I've spoken to women who have had the procedure, and it's dramatic in what it does for sexual responsiveness and a number of other sexually related dysfunctional issues. So let's take a look at the Geneveve system. It's a very simple little machine. It has a simple handpiece that both warms and cools at the same time. This way it can deliver the heat that's necessary to promote the tissue rejuvenation without causing any discomfort, because at the same time the receptors in the vagina that are sensitive to heat are cooled. So what's the technology behind it? We can see up here that there's a little bit of a sound wave that's produced. And the sound waves that are produced go down and they excite the water molecules, producing heat within the tissues. And this heat is enough to activate the restorative and reparative process. And it's through that reparative process new collagen is formed, that a tightening is then carried out. And this tightening will do a number of different things in terms of improving vaginal laxity. It will also promote a collagen healing of the tissues on the surface of the vagina, promoting an increased sensitivity. It will also lead to a tightening of the tissues around the urethra, which can lead to a decrease in urinary incontinence in women that are subject to that particular problem. And it's very interesting because a number of the other devices out there that are based upon lasers can be rather, kind of embarrassing the way that they have to applied. Okay, if you look at the Geneveve device, it's a very simple device that goes in at a very shallow depth. And what it does is it's just simply rotated around at that shallow depth in a very non-threatening and a very modest and a very respectful way. If we look at some of the lasers, we see that they have to be inserted to their full depth, Sometimes they have to be inserted and withdrawn, inserted and withdrawn, in an action, in a technique that sometimes can be a little bit uncomfortable, particularly when you're in an exposed position in a doctor's office. Another very cool thing about the Geneveve or the Geneveve device by Geneveve is the depth of penetration and thus the effective tissue reparative qualities that are available. We can see that some of the other RF or radio frequency or sound wave devices have a very shallow depth of penetration, and even some of the lasers are very, very shallow. So here's a typical RF device, and here's some of the lasers. But when we look at the Geneveve device, we see that it goes into a deeper level, and it promotes a wider healing and a deeper healing that ends up giving a far better result. I'm a clinician, okay? And when I bring something into my office, I want to make sure that I'm bringing in something that's proven effective. And while this technology is very new, we can see that there's a number of clinical studies already that are showing some dramatic improvement. We see significant improvement of vaginal tightness, increased improvement in vaginal scores, and increased of vaginal satisfaction. So why do we want to use the Geneveve device? It's very simple. We can answer some very important questions for people. It's a one and done treatment. Many of the other treatments take 2, 3, or even more applications in order to get the effect that you want. 2, it's virtually painless. The simultaneous heating and cooling that goes on provides a very comfortable environment, and virtually every woman that I've spoken to that have had this procedure feel virtually no pain or discomfort. Maybe sometimes a very, very mild warm sensation or a very mild cool sensation. There's virtually no post-procedure problems. There's no pain or bleeding that can be associated with the laser devices that actually cause direct thermal injury to the lining of the vagina. And it's not uncomfortable for some of these women to have to use pads. They miss work. They can't have sex for over a week. Not with the Geneveve. You're back to work the next day, and sex is very easy to undertake, even on the day following the procedure. As I already mentioned, it's a much more respectful procedure. It's proven in clinical studies, and I'll tell you what, for me and my women in my office, that's crucial. And we can actually see positive patient results. Many of you are familiar with Real Self, the cosmetic surgery site. Geneveve has been rated on the Real Self site and has a 96% worth it rating. Well, for me, that's a very good study. So, who should do Geneveve? Let's take a look at it. Do you feel like your tampons are falling out? They don't feel as snug as they used to be? Do you have a feeling of vaginal looseness during sex? Do you have diminished sensations during sexual intercourse? Are having more difficulty achieving orgasm, the ultimate goal of the sexual encounter in many people? Do you have an overall decrease in sexual satisfaction? Do you have an overall reduction in sexual well-being? Do you just avoid intimacy because it doesn't feel good anymore? Are you experiencing urinary incontinence or urinary leakage? A big indication for the Geneveve device. Have you noticed the thinning of the vaginal lining, an atrophy that's associated with increased pain or bleeding after sex? Is sexual decline having negative impact on your relationship? Has your decline in satisfaction led to a decline in your desire for sex? And has your vaginal physical changes over time led to a lower underconfidence and a loss of self-esteem? And finally, has your sexual decline led to a worsening of your quality of life? If you've answered yes to any of these questions, you might very well be a candidate for the Geneveve device and a one-and-done application to change your life. So let me ask you this. Are you willing to give me 30 minutes, and with that, give me and the Geneveve device an opportunity to change your life with him? I can tell you, it'll change yourself. This is Dr. John Carrozzella. I want to thank you for listening, and I invite you to call for a consultation to see if Geneveve is right for you.